HOD Professor A.K. Chaturvedi sir, my seminar guide Dr. S.S. Budara sir, seminar coordinator D.P. Sharma sir, faculty members, examiners and my batchmates. I am Mukul Thakur, pursuing my B.Tech from University Department of Mechanical Engineering, Rajasthan Technical University, Kota, Rajasthan. My seminar topic is Mechanical Ventilator. Moving on. So, in this session we are going to cover these topics. Next. So, introduction. A mechanical ventilator is a machine that helps a patient breathe when they are having surgery or cannot breathe on their own due to a critical illness. The patient is connected to the ventilator with a hollow tube that goes in their mouth and down into their trachea. They remain on the ventilator until they improve on their own. Next. Purpose of using mechanical ventilator. The purpose of mechanical ventilator is to maintain ventilation and oxygen and to decrease the work of breathing and improve patient's comfort. Moving on next. Types of mechanical ventilator. There are two types of mechanical ventilator. Negative pressure ventilator. Second, positive pressure ventilator. Next, moving on. Negative pressure ventilator. A negative pressure ventilator is a type of mechanical ventilator that stimulates an ill person's breathing by periodically applying negative air pressure to their body to expand and contract their chest cavity. Early negative pressure ventilators were known as iron lungs. The patient's body was encased in an iron cylinder and negative pressure was generated. The use of negative pressure ventilator is restricted in clinical practice because they limit positioning and movement and they lack adaptability to large and small body chest. Now moving on. Positive pressure ventilator. A positive pressure ventilator describes the process of either using a mask or more commonly a ventilator to deliver breath and to decrease the work of breathing in a critical ill patients. Now moving on. Types of positive pressure ventilator. There are three types of positive pressure ventilators. First, volume ventilator. Second, pressure ventilator. Third, high frequency ventilators. Now moving on. First, volume ventilator. The volume ventilator is commonly used in critical care settings. The basic principle of this ventilator is that a designed volume of air is delivered with each breath. With this mode of ventilation, a respiratory rate, inspiratory time and tighter volume are selected for the mechanical breaths. Now moving on to pressure ventilators. The use of pressure ventilator is increasing in critical care units. By meeting the patient's inspiratory flow demand throughout the inspiration, patient's efforts reduces and comfort increases. With pressure modes, the pressure level to be delivered is selected and with some more options, rate and inspiratory time are present as well. Moving on to high frequency ventilators. High frequency ventilators uses small tided volumes at greater frequencies. The high frequency ventilators accomplishes oxygen by the diffusion of oxygen and carbon dioxide from high to low gradients of concentration. High frequency ventilators would be used to achieve lower peak ventilator pressures, thereby lowering the risk of barotrauma. Now moving to advantages of mechanical ventilator. The patient does not have to work as hard to breathe. Their respiratory muscles rest, help the patients get adequate oxygen and clears carbon dioxide, preserves a stable airway and preventing injury from aspiration. Moving to disadvantages of mechanical ventilator. Patients feel discomfort, facial skin necrosis, increased aspiration risk, difficult to use on patients without an artificial airway. Now moving on to conclusion. So, patients on ventilator need constant observation and skilled care to protect, restore and maintain their health. Any question?
Yes. What is minute ventilation?
Minute ventilation. Tidal volume into respiratory rate is called minute ventilation. Any question?
No.
Thank you. Have a nice day.